I've definitely changed therapists, and in my younger days also ghosted therapists as well. Hi, my name is Jid and I'm a licensed clinical psychologist here at Intellect.
Hi, my name is Salman. I'm a counselor with Intellect.
Intellect is a mental well-being platform that provides support for mental health at any end of the spectrum, including face-to-face services in Singapore for those who need a bit more support.
We are starting a new series. It is called Right Beside You. Anything about mental health will be discussed in this series. For this episode specifically, we'll be answering questions that you have asked.
I think people often get confused. Counseling is a form of therapy.
I think if you look at therapy and counseling, there's like a 80-90% overlap. But of course, if we look at therapy or clinical psychology, it can be a little bit more on the one end of the spectrum, which is more to do with mental illnesses, whereas counseling would cover more of the middle section, but some of the end as well.
Day-to-day life issues can end up on both ends of the spectrum of people that come to see us.
From my experience and point of view, the main distinction here is on diagnosis and assessments. A clinical psychologist would be the best person to provide you with a formulation or a diagnosis of what you're experiencing, and a clinical psychologist would be able to also assess for learning and developmental challenges as well. There are different approaches, so just start with one. If you are in the need of a little bit more clinical or medical interventions, then of course your counselor or therapist would refer you or direct you to the proper help. But just start.
I think in our day-to-day lives, it is true that we struggle and we may not be immediately able to get these kind of external supports that we need. And maybe some things to consider, I think, always think about reaching out socially first. Sometimes it can be very difficult to open up and be vulnerable about what we're struggling with. But sometimes what we need best is a listening ear and somebody that can, validate and be there just to hear us and make us feel a little bit less lonely with whatever we're going through emotionally or in our minds. Other things that we can also be thinking about is, a lot of times I do know that when we struggle with depression or anxiety, the last thing we really want to do is to do things, right? Even more during those times, we feel like isolating or retreating into, our little safe spaces. But actually sometimes retreating can actually lead to a little bit more of these kind of difficult thoughts and feelings staying within us and growing. So it might also be helpful on top of speaking to people, just getting ourselves out there a little bit more, even if we may not really feel like it. And it's easier said than done. Obviously, I have my days like, forget it, I'm just going to Netflix at home. But at the same time, knowing or keeping in mind that maybe going for that walk, even if I don't feel like it, can just change things a little bit.
Other entry points, of course, other than the Intellect Clinic and the support that we have available, would be family service centers, and you would find them everywhere in Singapore in the heartlands. They have teams of counselors and social workers who can provide support as well.
And it is true that actually sometimes counseling can be on the lower end of the price point, and if you go to see like a clinical psychologist or other type of psychologist, the price point can change relatively, and all provide great counseling, great therapeutic interventions. I think it's more about what you are looking for at that point in time, and starting off with a counselor that suits your price point or needs. That's also wonderful. As a human being, of course, nobody wants to hear things that they don't like to hear, right? But at the same time, as therapists, we know that we may not always be the right fit, or the things that we're doing may not be listening to what the client needs at that point in time, what the person needs at that point in time. And every dynamic between two different people always shifts and changes. So it's perfectly okay and normal if you also find that maybe this therapist isn't the right fit for me, right? And we're allowed to say that. It may be helpful to raise it to the therapist and say, this isn't working for me. It's a teamwork, it's a collaboration, right? Contrary to pop psychology, therapists can't read people's minds. And so we're going off of the relationship that we have and things that we know and that people bring to the table as well. And personally, in my own journey with my therapy, I've definitely changed therapists, and in my younger days, also ghosted therapists as well. Um, but in hindsight, it's also realizing that it is a journey of finding what suits you and who gives you that feeling of this is most helpful for me at this point in my life, or this person is someone that I feel most comfortable with as well, being vulnerable.
I would probably explore a little bit more on why is it not happening, right? That would give me better insight into the client as a person, and also, what are they like? What is their expectations? And once I get to know a little bit more, I'm sure the following sessions that I have with them would be more catered to their needs. If you notice that your loved ones may need help, um, you are then the first starting point there. Do share with them about one, the resources available, but try to give them a listening ear. Now, if you identify that, oh wait, the conversation is going towards something that I can't really advise on or handle, then you can nudge them to say that, um, and be genuine about it in a sense that you are concerned about their mental health, and let them know that there are resources that you can reach out to. If necessary, be part of that process. So if they need to make an appointment, be with them while they are making that appointment. I think that is going to be a huge booster in terms of motivation, and they wouldn't feel like I'm the only one in the world who is going through something, right? They will have some support presence beside them while they are doing it.
Sometimes to help people along to feel more comfortable sharing about their issues, it also helps for us to share a little bit about ourselves, right? If we let our guards down, maybe people feel a bit more comfortable letting their guards down as well. We want to try to stay away from you, you have this problem, you are doing this, because that puts people on a defense mode already. And rather starting from, like lately I've been noticing you not come out as much, right? And I'm just feeling a bit concerned. It's not your usual way. Do you notice that as well? Something I would add to that as well, though, in our process of being really good friends and family members, is to also recognize our limits, right? That as much as we want to help somebody, we cannot change that person. And we cannot force the person to feel ready for something that they're not ready for. Right? So we can be that constant lending ear, but we also have to remember that our feelings, our emotional safety also matters. And sometimes it's a matter of saying, well, this is what I can do, and this is what I cannot do, right? And that doesn't make me a bad friend, or that doesn't mean I'm not trying or I don't care, right? But we have to know our boundaries and limits as well.
Just to add on to what Jit said, anything that you want to recommend to your loved ones is also available to you, right? That's all the time we have for today. Thank you so much for tuning in, and do look out for the next episode.
And if you have any other questions, have any feedback or things you want to hear more from us, please let us know in the comments, and we'll do our best to keep the ball rolling.